morning. So here's something new on our show that I used to do to my guests, and our gracious producer, Sadie, who's sitting over in the corner, doesn't do to our guests, and I'm going to insist that she starts doing it. But whenever I had guests on Medicare Cafe, especially in the pre-chat, I used to start it without telling them. Because I'm mean. That's not when I say it out loud, that's mean. Yeah. But like they would just be talking about something and making goofy noises and like making goofy faces and being like, oh, we're live. I wouldn't do it to like a guest that wasn't consistent. Like I did it to Mike all the time. I do it.
People who should know better.
Right. Carrie's too nice. I wouldn't do that to her. I'll do it to you. If I had control. Fine. So Chalen and I were talking. Well, first of all, welcome to the Medicare Cafe pre-chat. Again, you're joined by your hosts. My name's Olivia Richardson.
And I'm Chalen Jackson.
We're excited to for you guys to join us today. We're just kind of chilling and hanging out until 10 o'clock when the show officially starts. If you are watching the pre-recorded version of this, you want to get to the good stuff, just fast forward a couple minutes and we will get to our regularly scheduled programming. But in the meantime, I have a question for you, Chalen.
Yes.
There are two ways that people have thoughts, right? There is an inner monologue, like an inner voice.
Oh, is this like the conversation that everyone was
having?
That's
what everyone was having yesterday. And I genuinely don't know which one I am. I am so unself-aware. I don't know what I think of. So like the idea is there's two ways of thinking. There's inner monologues or reading words, right? So it's like, do you hear a voice as your thoughts, or do you just like, is it coming across like reading? Like when you read, do you hear a voice, or are you just interpreting real time as it goes? Do you require that extra processing?
I for sure have an internal monologue.
I have an internal monologue as well.
I think most people do. I think some people may not realize it. Some people may not realize it, but I think most people do.
I would be interested to hear like because I'm fairly confident mine's an internal monologue, but I just can't. I think it's because like I'm not sure because I cannot imagine the alternative to that. Like to imagine that people don't process thoughts the way that I process. Like think the same way, no. Yeah. But process information via an internal monologue. So when you think of, if I say to you, and this is a question for text, put in the chat, all the things. Ooh, Sadie, can you move from top chat to all the chats? The top chat to all the chats.
Oh, sorry.
No, you're good. If you, and that changed nothing. Oh, we got an extra chat. Good morning, William. William is my new best friend.
Yeah,
he's been an active listener for the past month or so, and he's genuinely my new best friend. When I tell you, if I say, "Hey, think of an apple," do you think of the word?
That was a whole different conversation about aphantasia.
Of course, you would know what it's called.
We talked about this for like 45 minutes yesterday. It's like, whether you can see pictures in your mind or not.
Can you see pictures in your mind?
And like to the degree to which you can.
Like the detail.
Like if someone says, think of a red delicious apple, do you just see do you just know you're thinking about an apple, or do you see like this vivid image of a crisp red delicious apple with the little stem and like maybe the little leaf like a cartoon,
and like
or do you see like the Apple logo or something in between that? So do you see like conceptual images, actual like realistic images, or do you just like know you're thinking about an apple but you can't actually picture it?
I think my brain's lazy, right? So, and again, guys, I know it's 10:01, and those who watch the recording says I was promised good content. This is very important. There's my other best friend, Emily. Hi, Emily. So this is what I feel about that. I think my brain's lazy. Because like if they say, like if I really like dig down, think about it, if people say like name a person, I clicked something. Is everything still good?
We're good.
I can't be trusted with you. If they say name a person, if I think about that person, yes, an image of that person pops up, but the image is not complete with me.
Sure.
Like if I think about my husband, Chad, I think about his outline. I'm thinking about his hair. I'm not even looking at his face or anything else. I just like that outline I know is my husband, Chad, right? I don't think that's because of any situation of how I think of things. I think my brain's just lazy. Like I got enough knowledge. I got enough of that. Move on to the next thought.
Well, I think it's a like trainable skill too. Like I think you could for sure train yourself to see like more vivid imagery. Oh yeah, Michelle says she sees very detailed thing. Well, I said red delicious, so if you're seeing a gala apple, like that's a problem.
Well, that is confusing. One more thing, and we're gonna get started today. Did you know that the CIA, and you probably already knew this belongs in our conspiracy room, the CIA has actively and admitted and has released reporting of them using, I can't remember the terms that they use, but basically psychics. That they say, I will think of like the term that they used it, but they're trying to find
Medium.
like not a medium. They have some like
Clairvoyance.
oh my gosh, Shady, I love what you're doing here, but that's not it. It's like some long term to say basically non-visual, like I don't know, I'll post about it, but it's basically like the CIA and what they're coming down to, like it's psychics. They're having people being able to go across the country and see inside. One of it was like the box. Like I think it was like finding the 10 Commandments. That said that's been missing for years. It was stolen. No one's found the 10 Commandments tablets or whatever. And they said that the CIA has been actively having psychics looking for it. And they said they believe they found it using a psychic.
So like I don't even feel like that's new. Like that's news for sure. But like the idea that like governments use people who are part of the occult, like that's been around forever
That's
and ever
just
and ever.
the funniest.
Like
to
I remember
me.
there's a movie from like 10, 15 years ago. I forget what it is, but like even during like Desert Storm and like the wars in Iraq, like we had like psychics and mediums and people over there. Like it's George Clooney's in it. It's called The Men Who Stare at Goats. I have no idea what
That's
I've
what
never
that's
even
about.
seen the
I've
movie,
never even seen the movie.
but I know that's what it's about. Anyway.
Welcome to the Medicare Cafe, guys. Like astral projection. Yes, Sean. Okay, you can tell who works for our office and who's just hanging out with us. Yes. Thank you, guys. Welcome to the Medicare Cafe. Welcome again for those of you who maybe got a little extra of our conspiracy stuff that I'm used to. And this wasn't on a conspiracy website. This was on my Unbiased podcast. You guys have heard me talk about this podcast called Unbiased. It's a governmental and not government, but anyway, we'll get to that later. Today, some Medicare stuff, guys. Let's talk. Today, we're going to talk about 3 topics. We're going to try to hit through them quickly. Number 1, handling the Medicare supplement backlash. Yeah. Carrie and I started this last week. Didn't get quite through it about like how do we handle the conversation? What should we be telling our clients? She just saw a huge uptick in clients saying, what the heck am I supposed to do with these increases? Yeah. So what does that look like? Lead generation. That's been a huge question right now. It has been leading up to this, but like just standing out in a crowded market. How are we handling that? And then we do have our compliance officer here. Chalen holds many talents, but understanding compliance, understanding technology is one of them. So I want to take advantage of that. Sure. What does compliance and tech look like? Especially going to this AEP, leading up to this, tech was so important.
Absolutely.
There's a lot of ways to do it wrong and non-compliantly, right?
Of course.
Let's start with well, no, I don't want to start with that. I want to start with the Medicare supplement fallout. So again, same slide as last week. We don't have to go over why the big rate increases. We know they're coming. 40%, 30%. We're excited to see SANS between 15 and 20%. Yeah. That's like exciting to see.
Anything under 20 just seems like a gift.
It just is a gift at this point. No end in sight. If you have questions as to why, view previous Medicare Cafe episodes. Chalen and I are also joining Integrity on May 27th at 2 o'clock Central Standard Time for a disruptions webinar. If you have questions on that, we can talk about at the end. So we don't have to get like why is this happening. But Chalen, I know I've been receiving this question a lot. You work with our top percentage of our agents. What are we recommending agents? How we recommend having these conversations?
So it's really funny because I had this exact conversation with 2 of our agents yesterday, prepping for a panel we're doing in the near future. Yeah, and they have actually quite opposite approaches, and I'll tell you all the same thing I told them. There's kind of the camp of folks that say we're going to reach out to our clients every year, we're going to shop your rates, we're going to take care of you, make sure you're always in the lowest cost plan. And there's folks that say, listen, I'm going to tell my clients that if you want to shop every year, I'm probably not the agent for you. Like if you've got a problem, if it becomes unbearable, for sure reach out, but you don't choose a med sup so you have to switch every year. That's not why you chose that product. And I told them, I said, listen, both of those approaches will work because your clients will learn what you train them to do.
So good. And it's like expectations. If you're expecting me to saying like, if you're wanting to shop every year, give them like a threshold. I think there was a conversation of the threshold. If it's up $50 per month, then we probably need to shop. If you're not comfortable with that threshold, then I might not be your agent, right? And it's just the expectations of when is it appropriate to reach out, when it's not, versus the other one, expectation, you don't have to worry about it. I have an office staff that can handle this for us. We'll reach out to you. Pros and cons of each.
Yeah, so I think it's obviously it's workload, right? So if you're reaching out every single year, no matter what, and shopping rates, like you have to have a way to make that worth your time. So you better have a really strong cross-selling game because you're going to reach out to a lot of people that don't need to make a change.
Yeah.
Even now, even with the rate increases we're seeing this year, someone's rates may go up $30 a month, and that may not be worth it for them to go through the hassle of changing, especially if you're in a, a non-birthday or anniversary rural state where they
Right.
do have to go through underwriting no matter what, or even in an anniversary or birthday rural state, that's still work. They're going to have to come in, or they're going to have to do the app. You're going to have to sit on the phone with them. Maybe that $30 a month isn't a big deal to them. So how are we making use of that time? That's either a quick touch point that doesn't take much time, but also doesn't provide much value. I know a lot of folks will say retention, retention, retention. That's why we do it. Send them a birthday card. Like it's more cost effective
Or
for
just
you.
like a mass communication saying, like,
Exactly.
you might be receiving some rate increases. Know that this is happening. If you have questions, reach
Absolutely.
out. But to proact, and plus, like, you also don't want to create panic where there isn't any. You don't want to, if a client's like, no, I'm used to rate increases. I know I had this. This is steeper than I was
Yeah.
anticipating. But you don't want to call them up and create extra planning. But I really like what you're saying about, like, the cross-selling aspect of it. You better make it worth your time, especially if you are in an anniversary rule or a birthday rule state. If you move them, you're going to lose commissions because
Absolutely.
guarantee issue, no matter how much way you cut it, you're losing commissions.
You're
And if you
losing
keep doing that, then you don't have a business anymore to continue to help people. Now, you always want to do what's in the best interest of the client, right? I'm not saying commissions should dictate where you put a person. I don't agree with that at all. But you should be offering them the full package of protection
For sure.
to make sure that, one, what are you doing with that premium saved, dollars saved? You can reinvest that elsewhere. And two, they're getting full coverage. You're still getting paid to do your job.
Yeah, absolutely.
So,
Well, and I think underwriting is such a critical skill that honestly a lot of agents lack right now. Like when was the last time you pop in the chat? When was the last time you underwrote a med sup?
yeah.
Because in a lot of cases, people just don't do that much anymore. We're up over 20 states now that have birthday or anniversary rules or some kind of expanded guaranteed issue. So underwriting is kind of out of vogue, but it's really critically important, especially if you're in a state like Illinois, a state like Utah, where they have an anniversary or birthday rule, but it only applies to open blocks and it's only a move to a different plan with the same carrier. So that's where underwriting is really critical because you're going to have to underwrite a lot of people into an open block before they can make that move from F to G or G to N with one of those birthday or anniversary rules.
So Terry asked a really great question, and I think it's a really important to the narrative. Terry, longtime listener, I appreciate you, said that he's asking specifically, where do all these raises actually go? The carriers only, or where, again, if all these rate increases are happening, where's the money going? Follow the money. Ultimately, Terry and everybody else wondering, we talk about this a lot. Medicare supplement companies are not pulling levers because they're greedy or they're wanting to make as much money as they can or they just want to be evil. I know that's a huge interpretation of how we see rate increases with insurance companies. It's their loss ratios. We said some statistics a while ago on the last disruption webinar, but profit margins for Medicare supplement companies on average are in the negative 0.4%, meaning that they are losing income on average on Medicare supplements, and that's just because the loss ratios are tremendous, growing 3% year-over-year loss ratios, which is not sustainable. So that's why, again, these are covering, the premiums are covering the loss ratios, the loss made due to claims. And the thing is that the premium increases are not keeping up with the loss ratio increases. So we're seeing 40% rate increases in that state to really accommodate it. It probably should have been 60 to 70% rate increases if they really wanted to close the gap between loss ratios and premium.
Well, and we're seeing a couple different things because those rate increases are all highly regulated. Like I can't think of a state that doesn't have an MLR requirement on med sups. Like there are requirements for how much they can raise premiums, what they have to cover, what they have to be spending on a medical loss ratio basis. So like that's all baked into their rate filings. And then also they have to negotiate with the Department of Insurance in that state every year for what they actually want to make that rate increase. And, in the past, a lot of departments of insurance have played hardball with them. Someone might file a 20% rate increase,
Can't do that.
and the DOI might say, nope, you're going to get 12. That's all we will approve. And they just kind of have to live with that. Well,
Well, and it's like
now,
negotiation, right? Like file high, knowing that you're going to have to
sure.
come down.
Yep. And then now a lot of DOIs are realizing that, that has not been the best policy, because now you've got carriers pulling out of states. You've got carriers that just can't afford to stay in business in a particular state. So they're starting to loosen that up. So we're maybe even seeing a little bit of that file high mentality, where you
File
think you're going
high.
to have to negotiate.
That sounds funnier than it
But
actually is.
now they're not getting that negotiation.
Yeah.
So, file for 30, expecting you might get 20, but now they're actually just approving the 30. And that's
know.
really what they needed in the first place.
What they needed, but now carriers are going to have to adjust, and it's per state too.
Yeah,
Like
absolutely.
I know with the one we were talking to and talking about, Illinois is always coming back saying you can do a percentage of what you filed. A percentage of that will actually let you approve. And Illinois is now just saying let it fly. They're not coming back with any negotiations.
Yeah.
So it's per state, but I mean, we know Illinois tends to be a state that is not going to favor the company, not going to favor the corporation. And yeah, so it is interesting. So final thoughts on the Medicare supplement. Again, 2 trains of thoughts. Call them, get ahead of it, be proactive, versus set the expectations of if your rate increase isn't high enough, don't bother with me. If you're going to want to shop every year, I'm not your agent.
Well, and we're jumping ahead to tech for half a second, but if you
Not play by the rules.
you are using good technology resources, there is no reason that you can't automate this by carrier.
Yeah.
If you've got a CRM that's set up with all of your clients properly tagged, properly documented, there is no reason that you can't run a report and send an email to all of your Mutual of Omaha clients, or all your Cigna clients, or all your United clients when rate increase season rolls around, and they can just get that notification all at once saying, hey, it's rate increase season. If you have a question, feel free to reach out. But it's not concerning to me right now unless it's concerning to you. Because here's the deal. At the end of the day, we sell med sups because the worst thing that can happen to someone on a med sup is that the rate goes up.
Yeah.
That's literally the worst case scenario. They don't have to worry about their main carrier going out of the network, or their main provider going out of the network. They don't have to worry about massive swings in max out of pockets or basic benefits. The worst possible case scenario is the rate goes up. And that's the kind of security a MedSup client is buying.
Carrie talked about that last week. That premium is not the reason that they buy it. It's because it's all the security. And I think it actually leads William, my best friend William, asked a really great question that kind of leads into that, saying some carriers have made huge improvements, he said big, I'll say huge, to their PPO plans, Medicare Advantage speaking. Do you see these as a good alternative to Medicare Supplements people who are concerned with the rate hikes? I will give my 2 cents, but Chalen, I think I'd love to hear from you.
Sure.
2 things. Number 1, again, remembering why people buy Medicare supplements. It is for the risk. These are very risk aversion people. PPOs do not necessarily relieve that risk. You still have to deal with networks, obviously to a lesser degree, but you still have networks that you have to deal with. You still have a third party, aka a private company, managing your healthcare, which comes with its, challenges. So I don't think a PPO, in the eyes of a consumer, if you're selling a Medicare supplement appropriately, a PPO does not alleviate that. Just based on how the fundamental differences of why you buy a med sup, you wouldn't want a PPO in that case. The second thing I'll say is that I think you can expect to see significant decreases in 2026 to PPO benefits.
Sure,
So, Chalen, do you mind taking that on?
No, I absolutely agree. I think PPOs are not going anywhere as a product, but yeah, absolutely expect to see some rollback on those harder to manage benefits, those harder to manage plans. We're anticipating, another kind of tough year for carriers in the MA space. Now, that said, William, I would absolutely agree and take a slightly contrarian opinion. I think MA is exactly designed to be an alternative to MedSup, and for some folks, it does work really well. Now, we know for a fact there's around 2% of folks that go from MedSup to MA every year. So that's around 380,000 people that go from MedSup to MA every year. And what we know is only around 2 to 4% of those people actually use Trial Right to go back into a med sup. So of the 380,000 people last year that likely went from a med sup to an MA, only maybe a couple thousand actually went back to a med sup. So people are largely happy with that choice, but it still has to make sense for that individual client, make sense for their health, their wealth. That whole package of protection is really important to put together.
I think that's a really excellent point of view, and the numbers to back up. Those who move to Medicare or Medicare Advantage plan don't necessarily move back, not at the numbers that I think a lot of people expected. So that's super helpful to kind of say, no, people who go on there do enjoy it. And oftentimes truly can't afford the Medicare supplement.
Absolutely.
But to answer your question, William, yes, you are going to see, again, like the products that we're seeing lately. What was the rate increase differentiation between the G and the N? It was like a 20% on F, 30% on G. What was N after that? I don't even remember.
I mean, N is...
It wasn't even like...
Yeah, no, N is still... Everything I have seen so far this spring, N has been like 8 to 15%.
Left alone in comparison, right?
Like pretty low.
So, yeah, those who are struggling to come up with the plan G, oftentimes if they like the risk aversion, if they like the worst thing that's going to happen to me is my premium goes up. If they are more so going to focus on I want my plan there, regardless if I use it or not. I want to have that security net of a Medicare supplement. Then 100% plan in. I'm seeing, we talked about this a lot, high deductible plan Gs paired with a hospital indemnity plan, really, really popular lately and growing in popularity.
Yeah.
I think the big thing is if you're going to write a Medicare supplement, cross-selling is so important to you specifically, not just because of the lack of product, but you're 100% right. A lot of these organizations are going to areas with these massive rate increases. Illinois right now is getting hit huge by call centers and agents who are trying to take advantage of the rate increases there, just to pick on them. So your clients are more susceptible. And I think that's fair. They're going to be targeted. So it's so important to you to have more stickiness with that client. So if your client has a hospital indemnity, a cancer plan, a dental vision hearing with you, someone calls them about their Medicare supplement, they are much more likely to hang up the phone and call you because all of their other products are with you. So yes, cross-selling is going to be important for all the obvious reasons, but for the stickiness of that client, very, very, very important. Brian, I have a question for you. What do you think of the new setup? Brian's one of our OG listeners, hasn't been on for a while. Brian, I want to hear what you have to say about our setup. So I saw a question, what FMO pays the most overrides on Medicare Advantage? If you have questions about, again, FMOs, where they compete, where to do the research of that, obviously you can call Senior Marketing Specialist. That number is 1-800-689-2800. Shoot me a text and I will text you back that phone number. But there's so much that goes into overrides. There's so much that goes into level increases. What a FMO is allowed to give versus what the carriers insist and what the carriers have rules and regulations for. So we don't discuss that on here because it is such a wide net. But thoughts on that?
Oh, I'm with you.
A couple more questions I want to address. That's 2 questions to ask for the change of MedSup to Medicare Advantage are 1, will you sleep at night with this change? And 2, are you disciplined to put money aside for the co-pays? No, Michelle, that's a really great point. Great questions to ask somebody who wants to make that transition over. Yeah. I know Sadie and I, when we've done our trainings in the past, I'm like, I'm a med sup person because I'm lazy.
Sure.
Like, it's somebody that I'm like, I would rather invest money than time, honestly, in that. So, absolutely. Very interested.
Now, I think it's a really important conversation to have with, especially like your T65 clients, someone who may be coming off of, a long career with a group plan, maybe they've got $20,000 in an HSA account sitting there to help fund their health care for the rest of their life. Mm-hmm. They may not care about those copays and deductibles. Mm-hmm. They may be more than willing to deal with that since they've already got that money set aside. But very, very good points of conversation, Michelle.
So I'm actually going to skip it to our third and final point because I want to make sure we have plenty of time for that. We'll come back to leads. That might be another one that crosses over for next week. But let's talk about for a little bit the tech and compliance. The reason why I want to talk about this more so than the lead generation is because last year we saw the strongest survived, the strongest grew last year, AEP Absolutely. Speaking and how agents. When we talk to agents about those agents that grew year over year and wasn't just, I think you said before, chasing their tails, trying to retain their
Absolutely.
business, were because those were agents who utilized technology to not replace consumer experience, but to enhance their what's it called, processes, their proficiencies, their efficiencies, right? So we are a huge advocate for using
Of course.
technology to build on what you're doing to make you more efficient. But I know some people did it the right way. Some people did it in a little scary ways. That's not like it's not like they're trying to do something bad, but just uneducated about how technology works. So let's hit on this a little bit, Chalen. Can you tell me a little bit about let's start with HIPAA.
Okay.
Let's talk about compliance because we have people storing phone calls, storing scope appointments, sharing drug information, sharing health information via email, or having lead generation that put your medications in this email, send it to me. Tell me a little bit about what do we like, what scares us?
Yeah, so we like any time that you have a proper business associate agreement with your vendor of choice to store all that data that allows you to be HIPAA compliant and attests to the security of their system. We don't like random Google folders or keeping it on an unsecured desktop for sure.
Oh, yeah. Because if you lose that computer or if you lose any of your devices, and it's an unsecure platform, then you have to turn in that you have compromised information for every single one of your clients to the carriers, to the clients, right?
Absolutely.
So don't keep HIPAA information on a desktop on your computer. Okay.
Absolutely. No, yeah. I mean, double secured, all of it. We all know the HIPAA rules, but really pay attention with that data storage. If you are using a Google Drive to store your calls and data, make sure that you have that actual Google Workspace account, that upgraded account, so they will sign the business associate agreement with you or whatever platform you're using. Make sure that you are upgrading your insurance coverage. You don't only need E&O. You also need things like cyber liability, business interruption, all of those to protect the other aspects of your business that are not just the professional advice that you provide to your clients.
Sure.
And then, I think one of the other big things to look at is just how you utilize that data.
Yeah.
What are you doing with that data to really maximize your business? And how are you searching that data? How are you optimizing it in your CRM, in the systems that you use? Because we can maintain privacy and still get a lot of value out of that data that we have.
Yeah. I think, again, obviously where I'm going to point to is the technology that I work with the most, which is Medicare Center, that you can send compliantly double-way authentication. You can send and receive HIPAA's compliant or HIPAA information, and you don't have to worry about it getting exposed or it getting taken. Because a lot of times, people don't think about, and I want to jump to this point next, is AI.
Yeah.
And what AI, when you're utilizing AI, what are some not safe ways? What are some safe ways? But when you're working with a program that offers artificial intelligence, most programs will take content from outside of their loop, from all over the internet, and apply it there. And then you're actually giving them access to your content for them to go apply to other areas of the internet, right? So making sure that if you are using AI, never, unless it's unless it's something like Ask Integrity, which is a closed
loop.
A closed loop AI does not use outside sources, outside integrity sources. But making sure that you're never putting sensitive information in ChatGPT or in marketing or in any type of AI technology because you are giving them access to that and it's not protected.
And being careful when you're using AI in your marketing,
Let's talk about that.
Yeah, just really being careful of, especially if you're doing any kind of phone sales, being really cautious about that AI use, not using AI voice, not using AI text, running afoul of TCPA law and things like that. So there's ways to do it right. There's ways to do it wrong with all of these things. And I think that's the bigger conversation because inevitably, if the question is, should I use tech? Should I use AI? The answer is always going to be yes. But
where?
But where and how? And there's a lot of that. There's a lot of learning how to use it correctly to stay on the right side of the law to make sure that, we talked about data loss and HIPAA, the average data security breach, at least this is probably 2 or 3 year old data, but on average you're going to spend around $500 per record just to meet your reporting requirements. So if you have an unsecured laptop or something like we talked about, and you do have that data security event that's a reportable event, and you end up having to go through the process of notifying clients, notifying the state, notifying all the proper authorities, it's going to cost you on average $500 per record. If you've got 500 clients, That's a lot of money. That's $25,000. That's where cyber liability insurance is a critical part of your business continuation.
Yeah. No, it's stuff that, again, like, you think is harmless. Or,
Yeah.
like, that would never happen to me. Like, they're not after me, an individual insurance agent or a small agency. You know, they're not coming after me. But my goodness, we've worked with agents in the past that they did. They call it ransomware. Yes, and they had to pay huge sums of money for their to get it back.
Yeah.
And 2, for it not to get released elsewhere. So nobody is safe.
No, not at all. Not at all.
The number 3 or 4th or 19th thing, verifying your leads with tech. I have no idea what this is. You said you wanted to talk about that.
Sure. Well,
And
that was
go.
we were going to talk a lot about leads. So
Yeah. Well, let's talk. Okay, so leads, we'll have to hang that till next time.
Sure.
But this is interesting.
Okay, sure. So most people who are using leads, especially if you're using like a web form to generate any kind of leads, the industry standard is something like Trusted Form or Jornaya, which is basically a verification plug-in.
Wow.
You're going to plug that into your lead system, and it's going to basically do a screen capture so you can actually see the person filling out that lead and basically provide proof that a person filled out this lead form, not
like
a bot,
Yeah.
not not you just said that it was a lead form. It's going to capture IP address. It's going to basically screen capture them putting the information in. That way, you can prove that you didn't just buy a cold call list and then punch them all into your own form so it looked like a lead.
Yeah.
So it's a pretty industry standard way to verify the veracity of a lead, verify that it is a legitimate lead, and it comes in real handy in the event of a compliance investigation.
Yeah, very handy. Okay, and what is that called again? I
So
don't know this.
there are two of the big ones. There's several, but two of the big ones are both Trusted Form and Jornaya.
Jornaya. How do you spell Jornaya? I'm putting you on the spot. I don't know how to spell Jornaya.
Someone Google it.
Jornaya. Is it a J or a G?
It's a J. It's for sure a J. Jornaya, maybe.
Okay. Well, if it's not right,
Something
everybody call
like
Chalen
that.
out. Guys, thank you for hanging out with us today. Again, on these segments, I always love it when I have someone like Chalen. I always say my talent is I'm an inch deep, a mile wide. Chalen's somehow a mile wide and also a mile deep. So it's always really impressive to have you on the show, Chalen. So thank you.
Way less flattering than you thought it was.
Why? A mile wide, a mile deep. You know a lot about a lot.
I know a lot about a lot.
You know a lot about a lot. So appreciate Chalen for being on the show and giving us this input. Again, for everybody else, if you do have, we are at the end of the show. Next week, let's talk about leads. Let's talk about how to stand out. Let's make that kind of the main event. William, I want to answer your question really quick. He's asking, can you cross-sell a Medicare supplement appointment, or do you need to address it and set it up a separate appointment for it? It's really an interesting question, William. The answer is it depends if you have a scope of appointment. If you are selling at that Medicare supplement appointment, if you are also selling them a prescription drug plan, then they have signed a scope of appointment, and you're limited to what's discussed on the scope of appointment, which is going to be hospital indemnity, dental insurance, and now they say other ancillary products or other ancillary health benefits. So like cancer insurance, we included on that, potentially home health care, not life insurance, not annuities, nothing financially based. So so you do still, even if they do sign a scope of appointment, because you're also cross-selling a prescription drug plan, you do have a lot of other ancillary products to sell. But if it's just a med supp replacement, you're not reviewing the prescriptions, then you really aren't limited to what you can cross-sell, period.
Agreed.
Great question. See, Lindsay agrees. She says Chalen knows all things. Chalen sure does know all things. One time, okay, I want some feedback on this because we missed it again this year. But one day, we've talked about it now for like 2 years, maybe 3. I would love to do a webinar series on April Fool's Day of Chalen, just like, this is like we're doing a webinar. Like, obviously, we're an insurance company. Let's do, not an insurance company, we're an FMO. Let's do a webinar on fly base or how to make fishing. Fly tying. Like, let's just do like a full webinar on that and just not even address that this the most bizarre thing, or like actually like let's have Chalen teach us, like we talked about one, like let's hollow out and like let's make a canoe. Let me teach you how to make a canoe and just have that be so serious for an April Fool's joke. But
it'd be great.
Let me know if you want to see that. Any other questions, comments, concerns, threats, or promises, please let us know. Shoot me a text. Again, even if you're watching the recorded version of this, you can text me at any time. I try to respond within the same 24 hours. But guys, appreciate you all. Chalen, thank you.
Of course.
Until next time, y'all, have fun.
Make money.
And give impeccable service.